think some good things can come out of this whole COVID crisis. Behind me, you see some images of a patient of mine. His name is Edwin. He asked me to share his story, and following this little piece from me, you're going to hear his own, his side of his story, because that's what matters the most. But during the COVID crisis, when our office was asked to shut down, I was home quite a lot, and I get a phone call followed by a text from this person that is in Richmond, and we're in Fairfax, Virginia. It's a 2-hour difference. And I don't normally answer emergency calls from non-patients, but this one, it just sounded so sad. Edwin suffered from a plethora of TMJ symptoms, and he was desperate. He had been to, he says, 15 other doctors, and was just looking for answers. And when I listened to his voicemail, it just sounded like he was in a bad place. And then I read his text, and I just felt an obligation to reach out to him. I think it was a Saturday. And he was really surprised I called him, but after listening to his story, I told him that we'd see him as soon as we were allowed to see patients. So if you look at Edwin, I want you to take a look at some of these images with me. He came in with a lot of different symptoms: major pain in his ears that he had seen an ear, nose, and throat doctor, or congestion, ringing in the ears, massive neck pain, daily headaches and migraines, face pain, jaw pain, pressure and pain behind his eyes. He had been scanned to check for brain tumors. He had been to neurologists, different medical doctors, tried different medications. I think the last one he tried was somebody, I think it was a psychologist, because they were telling him he just suffered from anxiety and there's nothing wrong with him. And he would do what each person told him, but again, as the symptoms would come back, his pain would come back, he realized that wasn't the answer. So he went online and he saw a Google video of another patient of mine we treated some years back, and it just sounded like him, he said, and that's how he reached out to us. So he wanted me to share his story, and we're going to continue his story as he progresses and feels better. But you know, when we look at Edwin, he is a young male, very healthy young male, no other conditions than what he was suffering from, but he does have a pretty bad forward head posture, which can cause a lot of issues with the upper back and even go down to the lower back, which was affecting his work. And even though Edwin has a nice smile, the bite is very deep, and everything is kind of tipped in and collapsed in. So sometimes you can have very straight teeth, and people say there's nothing wrong with your teeth. This sets you up in a position where the jaw is not comfortable, and it tends to make you want to clench and grind, which can start to spin other issues. He also has a tongue tie, meaning this frenum attachment right here, this fascial attachment, is tethered down, which also puts his tongue back further in his throat. And because it does that, he has to keep his head forward to open up his airway. He was also diagnosed with having obstructive sleep apnea, and on a young, healthy male that's pretty thin, not having adenoids and tonsils, that's something this doesn't make sense to him, and it didn't make sense to us. So these are some of the reasons why he sought care, and from this point forward, I'll let you hear his story. But patients like him is exactly why we do what we do. Seeing if we can help somebody improve their quality of life, letting them know that they're going to be okay and it is treatable. So I would get out of bed, and makes me thrilled to be able to do what I can do. So enjoy his story. I hope it helps somebody else out there.
The main reason I came in was because I was having really bad back pain, neck pain, and jaw pain. I was having a lot of trouble breathing. I got diagnosed with sleep apnea at a really young age, at a mild rate. So I was having a bunch of problems with my bite, chewing, biting my tongue not fitting in my mouth properly. And the pain was the number one for me. But I'm hoping to achieve a new bite, a correct bite, hoping to open up my airways a little bit and get my teeth straightened up. But I went from having the back pain, the face pain, the ear pain, the neck pain, throat pain, to having breathing problems. And from the breathing problems, I went to
difficulty sleeping.
Yeah, I couldn't sleep. I'd start to fall asleep, and within 15 minutes, I'd wake up gasping like I couldn't breathe. And then I got to the point where I would sleep for a couple hours, and I'd wake up at the same 2-3 times every night. And then eventually that went from built up anxiety and stress, and then everything added all together felt like literally the world was ending for me. So one night I came home, and I'd been to multiple doctors. I've probably been to like 15 different types of specialists, a gastro specialist, ear, nose, and throat, cancer doctors. I mean, I literally went everywhere. I got brain scans. I mean, I did everything.
Were prescribed with medications for what?
I got prescribed with omeprazole, which is for acid reflux. I got prescribed with my anxiety medicine. I got prescribed pain medicine. I mean, I've taken so much antibiotics. I've taken so much stuff that I can't even remember the names of it just because it's so much. But one night I came home, I was feeling horrible. My neck hurt, my back hurt, my throat hurt. I felt like my throat was kind of like closing up, and I just literally couldn't breathe. And on top of the not being able to breathe, the pain was on a scale from 1 to 10, like an 11. So like, I got on my phone and I started Googling just symptoms and all types of stuff. And I've done this 100 times before. I just never came across TMJ or tongue tie or anything like that. And when you Google your symptoms, the scariest things possible pop up first. So I mean, that's the stuff that you focus your attention on, just because I mean that's the first thing that pops up, and it's the scariest thing. And I just kept scrolling and scrolling and scrolling, and down towards halfway down the screen, I saw this office, and it was a video of a girl on YouTube explaining the same symptoms that she had, and how long she had been dealing with it, and how all the doctors kept telling her that nothing was wrong, and she was perfectly healthy, and that there's no pain, it's just in your head, and the whole 9 yards. So that night, it was like, I think it was like 7:30. I knew nobody was gonna answer the phone, and just out of hope, I was like, well, let me call anyway. So I called the office and nobody answered, but on the auto machine, it was like, there's an emergency number for like on call, I guess. And
I'm the only one on call.
Right.
That's just me.
So Dr. Marzban didn't answer, but then I sent her a long text, and within like 3 minutes, she had called me back, and I was explaining to her all the symptoms I had, and I was explaining to her how I lived in Mechanicsville, but y'all are in Fairfax, and that it would be difficult for me to get there, but if she thinks that my symptoms match with studies that y'all do, then it was obviously a good idea to come see her. And she even told me that she would refer me to people down towards where I live, but I told her that with all the research that I've done so far, I didn't think that anybody where I live knew enough about the situation. And I ended up making an appointment here, and ever since I started, I've been doing a lot better. I think right now I'm about at 70%, but I think we're starting to come over the hump.
And what are you wearing?
My orthotic.
Yeah,
my mouthpiece.
good. So you've been talking and eating and swallowing and drinking with your orthotic in.
Yes, at first it was like the worst thing ever. Like, it was almost worse than the pain that I was going through, but knowing that like it's gonna help. I think the worst thing was the pain from it, just because at first, like, you don't realize that you're about to put a hard piece of plastic in your mouth that's supposed to fit your teeth, but originally it doesn't fit 100% perfect. But over time, when we make the adjustments and stuff, it starts to feel a little bit more normal. But I'd say the pain went away in about a week, and then after...
In about a week after you started wearing it?
Yes.
The first
and then,
time?
Eating was hard at first, just because I did have to eat soft foods for a while just to get used to it, chewing, so I wouldn't bite my tongue and my lips and stuff. But that's gotten a lot easier over time. So like, I started off eating a lot of soft stuff. I didn't really eat like cheeseburgers or steak or anything like that. And over like the last 2 or 3 weeks, I've been able to eat a little bit more, and it feels a little bit more comfortable. And it's starting to feel a lot better. So like, something that's chewy that I wouldn't have ate a month ago, I can now eat, just because my jaws close at the same time, my teeth touch at the same time.
There's no pain when you chew?
No.
So a lot of times when we make the orthotic is based to his balanced physiologic bite. And when the teeth are not in that position to begin with, and you put a hard acrylic appliance in the mouth to a different position, it feels like you don't even know how to chew again. It's as if we give prosthetic legs to somebody who's lost their legs. They have to learn to walk again. And in a matter of a week, which isn't a long time, but it can feel like an eternity when this is what you're wearing and you're instructed, do not take it out except to brush and floss. It's a tough process to go through, but Edwin is beyond motivated, and it's really important for him to share his story because, you know, he finally feels like he found an answer to a lot of what he was suffering from, and he feels good, he feels normal, he feels happy. The guy doesn't stop smiling now, which makes me smile all the time too.
I think the hardest thing about the mouthpiece now, and it's not really hard, but if you're just one of those people that are stifled about brushing your teeth, is when you eat, like, you have to take it out right after you eat, immediately wash it. And I carry a toothbrush in my car now, just because, like, when I eat, I have to. Like, I can't eat popcorn when I don't have the orthotic in. Like, if I didn't have this, because it gets stuck in my teeth and I hate it.
Right.
So, like, when I have this, like, food does get under it and stuff, but you just have to take it out and clean it. Well, it's not too bad.
Your energy is great.
Yeah.
I don't know, I mean, this is why we do video, period, because I think we have a video when we first started. We're gonna send it to you so you can
You
see
probably see the depression in my face, like
the pain.
Yeah.
We see the patients, the pain in their eyes, and we go through this process with so many. And Ed, Maurice, and I we know the world of potential. You just have to be willing to try.
Right.
So I'm so glad you did.
Yeah.
Thanks for sharing your story.
It was definitely worth it, and especially since I drive 2 hours here, it's definitely worth it.
I'm glad you feel that way. So we're not done, and we hope to continue Edwin's story. The only main issues, and we'll go through the other symptoms that he came in with, but at this time, he still suffers from some neck issues. So his next step is going to be doing some myofunctional therapy, a tongue release, and he's seeking care at this point with some type of chiropractic to help finish the series of issues that he's got going on. But all the fires around here have been kind of put out, doing really well.